are two members of the Borders Youth Health Forum. We have made this film in order to interview key health professionals to ask them what they do and what their service provides.
And why? Because we know some young people have an issue of going and seeing their health professionals, and we hope we've made this film and I hope it'll help. Thank you.
My name's Dawn Moss and I'm nurse consultant for vulnerable children and young people.
What are you trying to achieve through the service that you provide?
We're trying to make sure that services are joined up, because what young people and families tell us is the one thing that they really kind of hate about health service is how you have to retell your story over and over again, and there's sort of duplication, or when you ask for something to be done it doesn't get done. So it's making sure that services are joined up, that we share information appropriately, and that we do what we say we're going to do.
So you're the bridge, the communication
yes,
point between
it is, yeah. That's a good way of explaining it. So.
Hey, come to lunch? I can't today.
Why?
Promise you won't tell anyone. But, well, I've got an appointment at the drop-in office. I'm not ready for people to hear about this because, well, if a teacher hears, they might tell my parents, and I'm not ready to talk about it with my parents yet.
You look rough.
Yeah, it was a party last night. Got
that bad?
Absolutely wasted. Yeah. I mean, I can't remember what happened.
Really?
No, I think I might have slept with someone.
You might have slept with someone. Did you use protection?
I can't remember, man. I was that drunk.
Well, is there anyone you can go to for help? Because I really don't know.
I don't know, I was going to ask you the same question, mate.
I really don't know.
What is your name and job title?
My name's Jill and I'm a school nurse. Very basically what we try to do is to try and ensure in any way possible that young people are happy, safe and healthy in school, but also at home and in the community. We feel that young people have little opportunity to maybe meet with health professionals in school. It's sometimes their first access to health professionals. And that link is a very good start to, you know, young people then being able to access services on their own. So at any opportunity we have, whether in group sessions, health improvement in classwork, drop-in situations, we tell them about the health service and, you know, the confidentiality around that and what's available.
How would the young people know about your service?
Many ways, again from our very close contact in school from a very early age, but also through, and certainly for young people in high school, through pastoral teachers. We have posters on the wall, our one-to-one work with young people. We have regular drop-ins also, telephone numbers around the school, and any correspondence I always add my telephone number, I have a mobile, and quite often access young people through text as well. As, you know, in a drop-in situation, whatever we discuss is confidential, it's private. I don't share with anyone else at all, parents, grandparents, doctors, unless I felt that young person was at risk of serious harm. And then I would tell them that then, you know, it's come a time we really need to be able to help you here and safeguard you, and we need to find someone else to share this with, to keep them safe. I think for the young people that I see, which, you know, we're speaking about hundreds and hundreds of kids, I would think the barrier is, one, they're going to tell my mum. If I go to someone like my GP, or I try to go to a sexual health clinic on an evening and my auntie sees me, these are the things that worry young people regarding these sensitive issues.
What is drop-in?
Drop-in is just as the title says, is it's an open door, a friendly face, which people who will understand and who will respect your confidentiality, in an area that you can discuss anything that you wish. Really, you can go on your own, or you can come with friends. Or
So you're nervous?
I just don't even really want to go in, to be honest. I'm too embarrassed what the doctor's going to say. I just don't really want to be here.
What do you think might stop a young person from going to see their GP?
I think if they were embarrassed about the reason they were having to go, or if it was something like their parents didn't know about, they'd been getting up to and it sort of left side effects of what they've been doing, and that'd stop them going down definitely.
To start off, what's your name and your job title?
My name's Kath Cormie and I'm a general practitioner.
And what is your service trying to achieve?
Well, basically we're known as primary health care. So what we do is we're the first port of call for anybody who feels unwell or has a problem that they think is related to their health. So they usually come to us as the first sort of source of advice.
Why is it important that your service is available to young people?
We see ourselves very much as a family-based service, if you like. So we're seeing young people really right from birth onwards. We feel it's very important that young people are comfortable to come and see us, initially obviously with their parents or carers, but then ultimately when they reach the age that they can make decisions for themselves, that they will feel comfortable to come and speak to us. If we can deal with their problems and worries at an early stage, hopefully we save them problems for the future.
So how confidential is the environment that your service is based in?
Well, all consultations take place in a room similar to the one we're in just now, which is soundproofed, and nobody would come into this room, you know, without knocking or phoning me prior to that. The records now are mainly held on the computer, but we do still have some paper records in the reception room, and our staff are all bound by a code of confidentiality so that they know that they are not allowed to disclose anything that they hear or see in the surgery to an outside person. We do have 1 or 2 posters up in the waiting area, and we have leaflets as well that young people can access if they want to hear more about the confidentiality side.
I think I'm pregnant.
What are you going to do?
I don't know.
You need to get a test though.
But I can't, because I know everyone at the co-op, I know everyone at the chemist, and to be quite frank, I'm too embarrassed to go to the doctors. I just don't know what to do.
Hey, have you heard?
What do you mean?
Jack.
Oh, the Jack at the party?
Yeah, Jack.
What?
Oh, yeah. Party. But it's Jack.
What? What?
Oh, hey, Jack.
Hey, Alex and I were just discussing, is it true about you, the party?
You know, like, last
You know what I
weekend?
mean?
Well, I don't know. I don't know what to do.
Oh.
Isn't it this health centre down in Gala?
I don't know, I've only heard briefly. Is that women?
I think it's called GAM or something like that. It's all doctors and they won't judge you. Why don't you just try going there?
Have you been down?
Well, I've not been, no, but I've heard someone has.
I'll see. I might go, yeah.
Yeah, I think that could be quite useful.
Yeah.
Your name and your job title? I'm Gillian Forbes and I'm lead nurse for Border Sexual Health in the Borders. And what are you trying to achieve through running these clinics? Our service is particularly geared to the under 25s. We provide full contraceptive services, we provide full sexually transmitted infection services, that's screening and testing and treating, and we provide termination advice and referrals as well. And also we do things obviously for older people like menopause services, things like that, and HIV clinics as well. Ultimately it's linked to something called the sexual health strategy. That's what our service works towards, which is targeted at young people. And what we're trying to achieve is obviously that young people are having safer sex, so we provide full contraception and free condoms throughout to try and protect them from sexually transmitted infections, and also to try and reduce teenage pregnancies and unwanted pregnancies. So that's really what we're trying to achieve in our service. We have an internet which is called Border Sexual Health Services, and I think now, because we
have worked with the schools, that they can actually access that in the schools. So it's just, if you typed in Borders Sexual Health, you would find it, and it's got a list there of all the clinics. We try and keep it up to date and what we provide, contraception, emergency contraception, our STI testing, our pregnancy testing. That's all on there, tells you how to get hold of it, tells you how to make an appointment. We also have leaflets. We also provide postal testing kits for chlamydia. They're available in GP surgeries. Leaflets are hopefully in GP surgeries as well. And obviously just phone in at our direct. All our clinics have one central number which we then sort out where you get an appointment. I mean, obviously they can phone our service, but I understand it is difficult for a young person to pick up the phone sometimes. So their first port of call could be the school nurse. We work very closely with the school nurse. The school nurse knows about our service. If they're worried about anything, they could go, all the school nurses in the Borders provide drop-in clinics. They could go along and discuss it with the school nurse, and then they would either phone us to discuss or refer into our service, especially for the youngsters that don't have a clinic in their area. That would be what I would recommend in the first place. Definitely speak to the school nurse.
I don't know what's wrong with me. I feel like, I don't know, just something up here. Do you want doctors or? I don't know if there's anybody at the doctors that could help me though.
What's the purpose of your service?
We offer a clinical service across the borders to young people, really from birth up to age 17 at the moment. It will actually go up to age 18 in a year or so's time, with a broad range of mental health type difficulties. We're the only statutory agency delivering mental health, but there are a lot of other people doing a great deal of very important and valuable mental health work in the community. There's from other people in health, for instance, school nurses, health visitors, all make a significant contribution to mental health, and the voluntary sector, Children First, Penumbra, Gala Youth Project. There'll be others, I'm sure, that aren't on my mind at the moment, but they all contribute hugely to the picture.
She knows me, and she knows my mum.
This is important. You have to do this.
It'll be fine.
Come on.
What she tells?
What are you trying to achieve through your service?
We offer one-to-one emotional support for young people who've got issues affecting their mental health and well-being. So what we do is try and let them speak about their issues and give them some coping mechanisms to cope with those issues. And we're very mindful about where we meet young people, because we use a variety of locations. Not all young people can come here. As you know, the infrastructure in the Borders is pretty poor. So we will meet young people in doctor's surgeries or community centres, or they come to our premises, you know, just wherever's convenient. And some young people, we actually see them in their own house. So we try to make ourselves as anonymous looking as possible as well. We don't go flashing about. We don't wear badges, you know, and we try to look just like ordinary people.
What is your name and your job title?
My name is Rachel Pullman, and I'm a looked after children's nurse, which my job is about looking after children and young people who have been placed in foster care for reasons that that their parents aren't able to look after them for a long period of time or for a short period of time. And my job is really to make sure that for the period that they're in foster care, that their health needs are met.
Can we just start off with what the names and job titles are?
Sure. Yeah, I'm Jane Kennedy. I'm the Senior Charge Nurse for Child Health.
And I'm Cheryl Johnston. I'm a staff nurse in Ward 15.
And what are you trying to achieve through the service that you provide?
Yeah, well, basically, there's two things. The first thing, our first aim is to provide the highest quality care for all children
and young people and their families, which is very much part of the care, when they come into the Borders General. But we also want to achieve a local service so that any children and young people who require hospital care can have it here on their doorstep rather than having to go up to the cities. We try to normalise children and young people as best as possible when they're in hospital, and that allows them to have friends coming in to visit if it's appropriate, and certainly family. We have an open visiting policy for mums and dads so they can come in at any point, and that's much more difficult if their parents have to travel to the city. So it's very important to have the service here in the Borders on the doorstep as far as possible for everyone around.
How confidential is the environment that you work in?
I think here in BJH, in the paediatric ward, we have got a very good setup. We do have quiet rooms, different treatment rooms, parent rooms, where we can take parents away to speak to on their own, or take the child or young person away to speak to in a confidential environment, who they feel that they're comfortable in talking to. As a staff nurse, I've only been qualified about 3 years, and because in similar ages, I do feel that a lot of the young people can come and talk to us and disclose information to us.
Thanks for watching, and we hope this film helped.
If you need any more information, here's where you can go.